lofty goals. We all have them, and really, we should, right?
Absolutely. Sometimes they even reach as far as outer space.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills. Because that challenge is one that we're willing to accept, one we are unwilling to postpone, and one we intend to win.
And when we did, 60 years ago today, President John F. Kennedy announced his Moonshot campaign. It was all to send Americans to the moon. So why did he decide on this big goal for the U.S.? He knew it wasn't going to be easy, but he said we had to do it in the race for space. There was no other option.
Yeah, then decades later, another president announced another kind of moonshot. This time around, the goal is to end cancer as we know it.
On the 60th anniversary of his clarion call, we face another inflection point. And together, we can choose to move forward with unity, hope, and optimism. And I believe we can usher in the same unwillingness to postpone, the same national purpose that will serve to organize and measure the best of our energies and skills to end cancer as we know it and even cure cancers once and for all.
Something we all want. So let's dig into what exactly President Joe Biden's cancer moonshot is.
We're going to start with how long it could take to see results from it.
The goal is to cut cancer death rates by at least 50% in the next 25 years. To turn more cancers from death sentences into chronic diseases people can live with.
The National Cancer Institute is launching a major national study to identify blood tests for early cancer detection that will eventually enroll thousands of participants. It's also opened a new grant opportunity to invest in the next generation of cancer researchers that are early in their careers. Now, in addition, the president is taking executive action to develop cutting-edge biotechnologies in the U.S. Biden first launched his Cancer Moonshot initiative when he was vice president back in 2016 after his son Beau died of brain cancer. He reignited his deeply personal ambition earlier this year. Kellen Morey hopes the president's push will save many lives, even though it's too late for her wife, Patricia Moreno. She died from cervical cancer earlier this year at the age of 57.
Early detection, in my wife's case, would have saved her life.
My being alive today is a miracle.
This breast cancer survivor says the Biden administration's stated focus on equity is also key in the fight against cancer.
Until we find a way to have people of color have better equitable options in clinical trials and treatments, we will have collateral damage, and that damage will be people's lives.
President Biden has also said that he hopes fighting cancer is an idea that can unite the country and show the world that anything is possible.
So the big speech just happened, but it's been going on for a while. In July, President Biden's Cancer Council announced its top priorities and actions. They included closing the screening gap, understanding and addressing environmental exposure, decreasing the impact of preventable cancers, bringing cutting-edge research to patients and communities, and supporting patients and caregivers. So far, the White House says some of these areas have made big progress in reaching those goals. The Inflation Reduction Act lowers prescription costs for cancer patients. The National Cancer Institute launched its Cancer Blood Test Study. And the Cancer Moonshot Scholars Program is already accepting applications for the next generation of cancer researchers.
All right, so let's pause. We're going to rewind here. Go back just a little over 6 years ago. Then President Barack Obama signed the 21st Century Cures Act into law. That investment was almost $2 billion for cancer research. Moonshot spearheaded by then Vice President Joe Biden.
I'd like everybody to just please join me in thanking what I consider to be the finest vice president in history. We are bringing to reality the possibility of new breakthroughs to some of the greatest health challenges of our time.
The funding from the 21st Century CARES Act is being distributed over a 7-year period. In January of last year, the program gave a midpoint progress update 4 years after its inception. The National Cancer Institute says they were able to create over 70 individual programs and fund over 240 research projects. So they made advancements in improving immunotherapy. They learned more about childhood cancers and its drivers. They created detailed maps of a variety of cancers, and they have worked to improve data and research sharing so that collaboration can continue even after funding for Project Moonshot runs out. So then where does the fight against cancer stand right now? A viral post circulating online suggested we may be closer to the end than we thought, but that's not really the whole story. Here's Brandon Lewis.
Finding a cure for cancer is the moonshot that scientists worldwide want to discover. So when Verify viewer Ashley spotted social media posts and headlines like these claiming one study achieved the impossible, she asked us if scientists really cured cancer. So Ashley, let's verify. Did a cancer drug trial cure all of the participants? Our sources are the results of a trial published in the New England Journal of Medicine and Dr. Tom George, an oncologist at the University of Florida. The posts and headlines referenced a study published in June. Researchers administered an immunotherapy drug to fewer than 20 people who suffered from a rare type of rectal cancer. After 6 months, the study showed the cancer entered remission for all patients, meaning their cancer was no longer detectable. Both the study authors and our source says while this is certainly exciting news, it's too soon to say the participants are cured.
We need more time to know that the cancer is truly permanently gone. We don't know that yet. What we know is that the cancer shrunk. It shrunk down so far that we can't see it anymore.
Researchers also want to make sure the cancer didn't spread to other parts of the body, as well as conduct a larger study to see if the drug works with more people with rectal cancer. So the claim that a cancer drug trial cured all of the participants needs context. This was a small study of patients who had a rare form of cancer that returned very promising results.
We're all very, very excited about this because it could usher in a new era for patients with bowel cancer.
Well, right now, finding a cure for cancer may seem like we are literally taking a shot at the moon.
But just like we eventually landed on the moon, an end to cancer as we know it could be coming eventually.